Well, let's learn about antibiotic stewardship guidelines. Core elements of stewardship consist of leadership commitment, accountability, drug expertise, action tracking, reporting, education. And the guidelines on resource limited settings are required only are consist of basic, intermediate, and advanced. Basic is required only limited resources, intermediate requires some resources, planning and dedication staff, and advanced require establishment of formal program with trained staff and dedicated resources. We have two categories of core elements and guidelines as per CDC and another is by WHO. The WHO core elements are same as the CDC, while the WHO guidelines is different from CDC in the way that it is divided into state, regional core elements in lower settings. As national plan strategies, regular guidelines, awareness education training, and supporting technologies. The guidelines of implementation stewardship program in resource limited settings as per CDC, as mentioned before, is categorized into three categories as basic, intermediate, and advanced. The basic promote the creation of national committees, develop national and subnational national stewardship action plans, then participate in the awareness campaigns, and adopt policies regarding prescription. While intermediate consists of developing and ensuring access to formularies, create and promote adherence to treatment guidelines, promote diagnostic stewardship, and support inclusion of antibiotic stewardship training. While advanced consists of enforce policies requiring prescriptions, track antibiotic dispensing, measure the antibiotic usage, describe the resistance patterns, monitor the antibiotic quality, and address the drivers of inappropriate prescribing behavior. But the guidelines as per WHO consist of national plans and regulation guidelines. In national plans, they have National Action Plan on MR, dedicated funding for the National Action Plan, technical working group of AMS, National AMS implementation plan, monitoring and evaluation mechanism in place. But the regulation guidelines consist of integration of the aware classification, up-to-date clinical guidelines, regulations on fixed dose combinations, regulation of prescription only sale of antibiotics, measures in place to ensure continued availability of quality ensured antibiotics, and measures in place to ensure affordability of essential antibiotics. Again, if you see these guidelines from CDC and WHO perspective, CDC consists of forming an antibiotic stewardship committee, starting with a single priority area, ensure appropriate policies and guidelines in place, educate the staff, and implement the activities. While in WHO, it is awareness, education, training, and supporting technologies. Awareness education, they have regular public antibiotic awareness campaigns, education in schools, training on competencies, education training, incentives. While in supporting technology, they compromise the national surveillance system on AMS in place, national system on AMR in place with lab capacity, then diagnostic test availability, and capacity building to optimize antibiotic usage. So guidelines for the evaluation of stewardship program in research limited setting as per CDC has monitoring and evaluation process as total antibiotic use measurement, appropriation of antibiotic selection and dosage duration frequency measurement, cost effectiveness measurement, resistance measurement, and clinical outcomes such as MRSA, VRE, bill, and others. The indicators are audit data, consumption of the antimicrobials in terms of defined daily doses, the antimicrobial consumption data in terms of DOT or LOT, the days of therapy, length of therapy, mortality, and length of stay. It also includes documented indication for antibiotic usage, stop or review date, compliance with the guidelines, 48-hour review, IV to oral switch, and other such strategies. The guidelines of IDS and Society of Healthcare Epidemiology of America plus AMSP guidelines constitute for the antimicrobial stewardship policy and procedures and implementing the program. The guidelines of ICMR, that is Indian Council of Medical Research, is the same as CDC and WHO. The guidelines for regarding the core elements, but the guidelines of stewardship program are based on implementation of stewardship. Implementation includes appropriate antimicrobial therapy, optimizing the prophylaxis, developing an antibiotic policies, prospective audit, formulary restriction, and improving the prescription. Evaluation done in terms of structural, process, and outcome measures. Structural, which includes availability committee. Process include like analysis of the consumption of antimicrobials. Outcomes include like monitoring the rate of infections and register. The implementation tools are adult inpatient antibiotic approval form, stewardship toolkit, sample daily pharmacy checklist, IV to oral guidelines and checklists and others. Strategies approaches include appropriate therapy, optimizing the prophylaxis, developing and implementing antibiotic policies, prospective auditing, pharma restriction, and strategies for stewardship as mentioned before for all formal restriction, education, antimicrobial homogeneity, combination therapy, streamlining and dose optimization all contribute for the antimicrobial stewardship success. Indian states have released their own action plan to combat the resistance like Delhi, Madhya Pradesh and Kerala. And they have their priorities are to improve the awareness, extend the knowledge, reduce the incidence of infection, optimize the use of agents, promote investment for activities, and strengthen the collaboration. Causes of resistance are overprescribing, patient not finishing the treatment, overuse of antibiotics in animal husbandry, poor infection practice in hospitals, lack of hygiene, lack of new antibiotics. Global action plan is to improve the awareness, strengthen the knowledge, reduce the incidence of infection, optimize the use of medicines, and ensure sustainable investment. The Kerala action, their priority indicators is awareness and understanding. Inputs are the IEC materials. Processes are raising the awareness for media at the state, district, and sub-district level. Outputs include the number of print articles covering the AMR. Outcomes also includes the AMR awareness levels and target populations, such as percentage of population covered by for the awareness, knowledge, attitude, and practice of the healthcare workers and others. The monitoring and evaluation framework includes the knowledge and evidence, state coordinating center for surveillance established with clear terms of reference, operational plan developed for AMR surveillance, number of hospitals, the SOPs, and AMR data from the sectors are considered for the activities. Output include the surveillance systems, report on AMR, AMR residue food environment, and reduce levels and trend of resistance in elections and other organisms. Monitoring areas framework consists of infection control. Input consists of the state nodal institutions. Processes are the percentage of hospitals with functioning IPC committee, percentage of hospitals with adequate IPC nurses. Then outcome includes the vaccine coverage across the state, proportion of acute healthcare facilities, average handling compliance, number of pharmaceutical companies having effluent treatment plan. Optimizing the use of antibiotics are the priority indicators. State nodal institutions identified with stewardship are the basic resources. Treatment guidelines constitute the process. Number of hospitals will update an antibiotic policy guidelines consider the outputs. Total consumption of antibiotics is the consumption of the outputs results of the population level. Priority indicators are the research and innovations, collaborations. Resources consider the state AMR monitoring cell established. Processes are the state AMR research data established. State AMR monitoring cell functional. Financing resources considered for output at the program level. And proportion of CARSUP activities at the population level. The state action plan of the input, process, and output and outcomes as from the slide. IC resources at the output, AMR awareness at the process, number of printing articles at the output at the program level, AMR awareness levels in population at the population level. Similarly, for framework, input is the state coordinate center, process at the number of microbial laboratories, output at the surveillance system, outcomes are the reduction in the AMR levels. Similarly, like we have for Kerala and Madhya Pradesh, we have for the Delhi, the input, process, output, basic resources, activities, results at the program level. Again, basic resources framework, activities framework, outputs, results at the program level, and again, I have the same line of monitoring and evaluation framework, parity indicators, input, process, output.